Hey everyone, it's Dr. Jess. Welcome and welcome back to my channel. In today's video, we're going to talk about beta blockers. We'll cover selective and non-selective beta blockers. Please don't forget to like the video, subscribe to the channel, and turn on your notification bell so you don't miss out on any new uploaded videos. Okay, let's get started. Let's talk about the mechanism of action of beta blockers. Beta 1 selective blockers selectively antagonize beta 1 adrenergic receptors in the heart muscle. So that leads to a negative chronotropic and inotropic effect. So negative chronotropic effect means reducing the heart rate, and negative inotropic effect means reducing the force of contraction of the heart. So that also leads to a decrease in cardiac output and a decrease in blood pressure. Next, we have beta 1 and beta 2 blockers. So these medications are non-selective. So the beta 1 and beta 2 blockers or non-selective beta blockers, they antagonize not only the beta 1 adrenergic receptors, but they also antagonize the beta 2 adrenergic receptors. So they have the same effect as the beta 1 selective blockers, but with the additional effect of the beta 2 blockade. So the beta 2 receptors are mostly located in the smooth muscle. So with beta 2 blockade, so that can lead to bronchospasm. Next, we have the non-selective beta blockers and alpha 1 blockers. These medications, they antagonize beta 1 adrenergic receptors, beta 2 adrenergic receptors, but additionally, they also selectively antagonize alpha 1 adrenergic receptors. So what does that mean? So alpha 1 blockade in the arteries leads to vasodilation. So that will lead to a more profound reduction in blood pressure. So the non-selective beta blockers and selective alpha 1 blockers with the additional alpha 1 blockade again will lead to vasodilation, and that will help to lower the blood pressure even more. What are some commonly used beta blockers? For beta 1 selective blockers, some of the most commonly used are atenolol or brand name tenormin, metoprolol tartrate or brand name Lopressor, metoprolol succinate or brand name Topol. Now, there are more beta 1 selective blockers, but I only listed the ones that are most commonly used. And beta 1 and beta 2 blockers, so the non-selective beta blockers. For example, we have propranolol or brand name Endural or Inopren. Non-selective beta blockers and alpha 1 blockers. Examples are carvedilol or brand name Coreg, labetalol or brand name Trendy. What are beta blockers used for? So beta blockers can be used for several conditions. For example, heart failure. In heart failure, the beta blockers that are used are carvedilol, metoprolol ER. Beta blockers can also be used status post NMI. They can also be used for hypertension, although they are not first line for hypertension. They can also be used for cardiac arrhythmias. Let's try this practice question together. Which of the following drugs is a beta blocker? Determine its brand name. A. Clothalidone, B. Enalapril, C. Amlodipine, D. Metoprolol succinate. And the answer is D. Metoprolol succinate. So metoprolol succinate is a beta blocker. An easy way to identify beta blockers, they all end in LOL. So for example, metoprolol, atenolol, carvedilol, labetalol, propranolol, and so forth. Determine its brand name. The brand name for metoprolol succinate is Topol. Side effects of beta blockers and monitoring parameters. So some of the side effects with beta blockers, as we've talked about, they lower the heart rate, hypotension, as they can lower the blood pressure. They can also cause fatigue, dizziness, and there's more side effects that I did not list here. Monitor the heart rate, monitor blood pressure. Also, something important to note is that beta blockers may mask the signs of hyperthyroidism. Again, that's because they lower the heart rate, for example, and they can also mask the signs of symptoms of hypoglycemia. Let's look at the second practice question together. Which of the following beta blockers may be more effective in lowering blood pressure? Explain the mechanism of action. I'll give you all 5 seconds to write your answer in the comments below. Which one do you think is the correct answer? Okay, so let's take a look at this. So A, atenolol. So atenolol is a selective, it's a beta-1 selective blocker. Metoprolol tartrate is also a beta-1 selective blocker. Metoprolol succinate is also a beta-1 selective blocker. Carvedilol is a non-selective beta and a selective alpha-1 blocker. So carvedilol with the alpha-1 blockade will cause vasodilation and cause a more profound lowering of the blood pressure. So the right answer is D, carvedilol. What are some contraindications and precautions to be aware of when it comes to beta blocker? Sinus bradycardia, second or third degree AV block, cardiogenic shock, asthma exacerbation. And with the asthma exacerbation, that's because mostly of the beta 2 blockade, and that can cause bronchospasm. Which of the following is true about the use of metoprolol succinate? A, it is a non-selective beta 1 and beta 2 blocker. B, its brand name is Lopressor. C, it is a negative chronotrope and therefore can lower your heart rate. D, A and C. E, B and C. Again, 5 seconds to write your answer in the comments below. Okay, let's take a look. So A, it is a non-selective beta 1 and beta 2 blocker. So that is false. Metoprolol is a selective beta 1 blocker. B, its brand name is Lopressor. That is also false. The brand name of metoprolol succinate is Topol. Metoprolol tartrate is Lopressor. That's the brand name for metoprolol tartrate. C, it is a negative chronotrope and therefore will lower your heart rate. That is true. So that means the correct answer is C. That's all I have for today. Please don't forget to like, subscribe, and turn on your notification bell on your way out. I'll see you in the next one. Bye.